What if the real problem isn't that your medication isn't working, but that your body is missing something far more basic? Because the truth is, most people with high blood sugar, fatigue, and nerve pain are not failing treatment, they're missing nutrients. You've probably been told, take your medication, watch your diet, exercise more, and yet your blood sugar still spikes. Your energy crashes by midday, and that strange tingling in your feet just won't go away. You feel it at night the most, that burning, that numbness, that unsettling sensation, like your body is slowly disconnecting from itself. And over time, it gets worse. More fatigue, more brain fog, more instability when you walk. Until one day, you start asking yourself, why isn't anything working? Here's the part most people never hear. It's not just about sugar. Because high blood sugar doesn't just sit in your bloodstream, it damages, it drains, it depletes. Your body begins to burn through critical vitamins at an accelerated rate, especially if you're over 60. And the more your body loses these nutrients, the harder it becomes to control glucose. Your cells stop responding properly. Your energy production drops. Your nerves begin to suffer. So even if you're doing everything right, you're still fighting an uphill battle. Because you're trying to fix a biochemical problem without the raw materials your body actually needs. This is why so many people feel stuck. They increase medication, but never address the underlying deficiency. And slowly, their symptoms don't just stay the same. They progress. More numbness, more pain, more exhaustion. But here's the shift that changes everything. You may not be lacking control. You may be lacking support. Because when your body is given the right nutrients, things begin to change. Your cells respond better. Your energy stabilizes. Your nerves stop deteriorating. And for the first time, you're not just managing symptoms. You're supporting the system. So before you assume nothing works, ask a different question. What if your body isn't broken, but simply missing what it needs to function? Because once you understand this, everything else starts to make sense. So what is really going on beneath the surface? Because the issue is not just high blood sugar, and it's not simply what you eat. The deeper problem is something far more silent. Your body is running out of essential vitamins, not slowly, but aggressively. When blood sugar remains elevated over time, even slightly, it creates a constant state of stress inside your body. Your cells are forced to work harder. Your metabolic system speeds up. And in the process, it begins to burn through key nutrients at an accelerated rate. This is what many experts refer to as a nutrient drain. And here's what makes it dangerous. You don't feel it happening. There's no immediate warning, no obvious signal that something is missing. But internally, your body is depleting the very compounds it needs to function. Vitamins like B1, vitamin D, and others involved in energy production and glucose control are being used faster than they can be replaced. And even if you're eating well, even if your diet looks healthy, it's often not enough, because absorption changes with age. After 60, your digestive system becomes less efficient. Your stomach produces less acid. Your intestines absorb fewer nutrients. And if you're taking medications like metformin, diuretics, or acid reducers, the problem becomes even worse. These medications can quietly interfere with nutrient absorption or increase the rate at which vitamins are lost. So now you have a double effect. Your body is using more nutrients and absorbing less at the same time. This creates a hidden deficiency, even in people who believe they are doing everything right. And once these deficiencies begin, a chain reaction starts. Your cells lose the ability to process glucose efficiently. Energy production declines. Inflammation increases. And your nerves, which are highly sensitive to nutrient supply, begin to suffer first. That's why symptoms like fatigue, brain fog, tingling, and numbness often appear long before more serious complications. Not because your body is failing, but because it is undersupplied. And until that imbalance is corrected, no amount of medication can fully restore function. Because you're trying to run a complex system without the fuel it was designed to use. And that changes everything. Now let's talk about one of the most overlooked nutrients in metabolic health, vitamin K2. Most people think of vitamins in simple terms: energy, immunity, general health. But vitamin K2 works very differently. It acts more like a traffic controller inside your body. Its primary role is not just to support health, but to direct where calcium goes, because calcium in your body is not always beneficial. If calcium ends up in the wrong places, your arteries, your soft tissues, your organs, it becomes dangerous. It leads to stiffness, blockage, and long-term damage. This process is known as calcification, and it happens silently. Vitamin K2 prevents this by activating a powerful protein, osteocalcin. Now, most people think osteocalcin is only related to bone health, but that's only part of the story. When osteocalcin is activated, it doesn't just move calcium into your bones. It also sends signals to your pancreas, helping it produce insulin more effectively. And at the same time, it improves how your cells respond to insulin. This is where things get interesting, because insulin resistance is one of the biggest problems in people with high blood sugar. Your body may be producing insulin, but your cells are no longer responding properly. Glucose stays trapped in your bloodstream, instead of being used for energy. But when vitamin K2 levels are sufficient and osteocalcin is active, insulin sensitivity can improve significantly. That means your cells become more receptive, more responsive, more efficient. Glucose is absorbed more easily, blood sugar becomes more stable, and your system begins to regain balance. But that's not all. Vitamin K2 also plays a critical role in reducing inflammation. And inflammation is one of the hidden drivers of insulin resistance. When inflammation is high, your body becomes less responsive to insulin signals. But when K2 helps reduce that inflammation, it creates a positive feedback loop: better insulin function, better glucose control, less metabolic stress. At the same time, by preventing calcium buildup in arteries, vitamin K2 helps maintain flexible, healthy blood vessels, which is essential for delivering oxygen and nutrients throughout your body, including to your nerves. Because without proper circulation, even the best nutrients cannot reach where they are needed. So when you look at vitamin K2, you're not just looking at a bone vitamin. You're looking at a metabolic regulator, a nutrient that connects calcium balance, insulin function, vascular health, and cellular efficiency. And when this system works properly, everything else begins to improve. Your blood sugar stabilizes, your energy increases, your risk of complications decreases. But when K2 is lacking, this entire system begins to break down. And most people never realize why. Because the problem isn't visible, but the impact is everywhere. And that's what makes vitamin K2 so important. Now let's look at one of the most critical areas affected by vitamin K2, your cardiovascular system. Because this is where the damage from poor metabolic health becomes most dangerous. When calcium is not properly regulated in your body, it doesn't just weaken your bones, it starts to accumulate in places it should never be, especially inside your arteries. This process is called arterial calcification. And unlike cholesterol buildup, it doesn't cause immediate symptoms. It happens quietly, slowly. Over years, your arteries begin to lose their flexibility. They become stiff, narrow, less responsive, and when that happens, your heart has to work harder just to push blood through. This increases your risk of high blood pressure, heart attack, stroke, all without any warning signs in the early stages. But this is where vitamin K2 becomes incredibly important, because K2 activates proteins that help pull calcium out of your arteries and redirect it back into your bones where it belongs. Think of it as a cleanup system. Without K2, calcium becomes a problem. With K2, calcium becomes an asset. Studies have shown that when vitamin K2 levels improve, the progression of arterial calcification can slow dramatically. And in some cases, vascular function begins to improve. Your blood vessels become more flexible, more elastic, more capable of responding to changes in blood flow. This improves circulation throughout your entire body. And better circulation means more oxygen delivery, better nutrient transport, less strain on the heart. But the benefits go even further. Vitamin K2 also supports the inner lining of your blood vessels, known as the endothelium. This lining plays a key role in regulating blood pressure and preventing inflammation. When it functions properly, your vessels stay relaxed and responsive, When it's damaged, your risk of cardiovascular disease increases significantly. By supporting endothelial function, vitamin K2 helps maintain a healthier vascular environment. And this is especially important if you have elevated blood sugar. Because high glucose levels accelerate vascular damage, they promote stiffness, inflammation, and plaque formation. But with sufficient K2, your body has a better chance of counteracting these effects. So again, this is not just about one vitamin. It's about restoring balance in a system that has been slowly breaking down. And when your blood vessels begin to function properly again, everything improves. Your heart works more efficiently, your circulation strengthens, and your overall risk begins to decrease. That's the real power of vitamin K2. But the impact of vitamin K2 doesn't stop at your heart. It extends into two of the most vulnerable systems in your body: your nerves and your kidneys. Let's start with your nerves. Your nervous system depends on a constant supply of oxygen and nutrients. Every signal, every movement, every sensation relies on that delivery system working perfectly. But when blood sugar is elevated and circulation becomes impaired, your nerves are among the first to suffer. They begin to lose their ability to transmit signals clearly. This is when symptoms appear: tingling, burning, numbness, sharp, shooting pain. Now here's where vitamin K2 plays an unexpected role. By improving vascular health and keeping your blood vessels flexible, K2 helps ensure that nutrients can still reach your nerve cells. But beyond circulation, K2 also activates protective proteins that help shield nerve tissue from damage. This slows the progression of nerve deterioration, and over time, it can help restore more stable nerve signaling. That's why some people begin to notice reduced numbness, less burning sensation, improved sensitivity, not overnight, but gradually, as the system stabilizes. Now let's talk about your kidneys. Your kidneys are constantly filtering your blood, removing waste, balancing fluids, maintaining internal stability. But high blood sugar places enormous stress on this system. Over time, the tiny filtering units inside your kidneys become damaged. Calcium deposits can form, inflammation increases, and filtration efficiency declines. This is how chronic kidney disease begins, and once it progresses, it becomes very difficult to reverse. Vitamin K2 helps intervene in this process. By preventing abnormal calcium buildup, it protects the delicate structures inside your kidneys. It also supports healthier blood flow, which is essential for proper filtration. And as inflammation decreases, the kidneys are able to function more efficiently. This means less stress on the system, better waste removal, improved long-term protection. So once again, vitamin K2 is not acting in isolation. It is supporting an interconnected system where circulation, nerve health, and organ function all depend on each other. And when that system is properly supported, the body doesn't just cope, it begins to recover. Now let's move to what may be the most important piece of this entire puzzle: a specific form of vitamin B1 known as benfotiamine, because not all vitamin B1 is the same. Most people are familiar with standard thiamine, the water-soluble form of B1. But here's the problem. Water-soluble vitamins have limitations. They are absorbed poorly, they are quickly flushed out of the body, and most importantly, they struggle to enter your cells, especially your nerve cells. This becomes a serious issue as you age, because after 60, your ability to absorb nutrients declines, and if you have elevated blood sugar, the problem becomes even worse. Your body begins to lose vitamin B1 at a much faster rate. In fact, studies suggest that people with metabolic disorders can burn through B1 up to 70–75% faster than normal. So now you have a perfect storm. You are losing more, absorbing less, and using more at the same time. This creates a hidden deficiency, even in people who believe they are eating well. And that deficiency directly affects your nerves. Because vitamin B1 is essential for energy production inside cells, proper nerve signaling, protection against metabolic stress. Without enough B1, your cells cannot regenerate energy efficiently. Your nerves begin to weaken, and symptoms start to appear: fatigue, brain fog, burning feet, tingling hands, loss of sensation. But this is where benfotiamine changes everything. Benfotiamine is a fat-soluble form of vitamin B1, and that one difference makes it dramatically more effective. Because fat-soluble compounds can pass through cell membranes easily, enter tissues more efficiently, remain active longer inside the body. This means benfotiamine can reach places that regular B1 cannot, including your nerve cells. In fact, research shows that benfotiamine can increase B1 levels inside tissues multiple times higher than standard thiamine. And once inside the cell, it begins to restore critical functions. Energy production improves, cellular stress decreases, nerve signaling becomes more stable. But perhaps the most important effect is protection. Because benfotiamine helps block the toxic pathways activated by excess glucose, these pathways are responsible for much of the damage seen in nerves, blood vessels, kidneys. By interrupting this process, benfotiamine acts like a shield. It doesn't just support function, it prevents further breakdown. And over time, this creates the conditions for recovery. People often report reduced burning sensations, less tingling, improved coordination, more stable energy, not because the symptom is being masked, but because the underlying system is being supported. So when you compare regular vitamin B1 to benfotiamine, the difference is not small. It's functional. One stays outside the cell. The other goes exactly where it's needed most. And that's why this form of B1 has become such a powerful tool in addressing the deeper causes of nerve-related issues, not by forcing the body, but by giving it what it was missing all along. To truly understand how this process works, we need to look at one of the most damaging effects of high blood sugar, glycation. Glycation occurs when excess glucose in your bloodstream begins to attach itself to proteins. At first, this might sound harmless, but over time, it creates harmful compounds known as advanced glycation end products, or AGEs. Think of AGEs as a kind of internal sugar rust. They slowly damage everything they touch. Your blood vessels become stiff, your tissues lose flexibility, your cells begin to malfunction, and your nerves, which are extremely sensitive, are among the first to suffer because once glycation builds up, it interferes with the delivery of oxygen and nutrients. It blocks communication between cells, and it triggers chronic inflammation. Now here's where the real problem begins. Inflammation feeds insulin resistance, and insulin resistance keeps blood sugar elevated, which leads to more glycation, creating a vicious cycle. More sugar, more damage, more dysfunction. And over time, this cycle becomes self-sustaining, even if your diet improves. Even if you take medication, the underlying damage continues. But this is where targeted support can make a difference. Because certain nutrients, especially benfotiamine, have been shown to interrupt this process. Benfotiamine helps block the biochemical pathways that lead to AGE formation. In some studies, these pathways were reduced by up to 40–50%, which is significant, because it means less internal damage, even when glucose levels are not perfectly controlled. At the same time, inflammation levels begin to drop, and when inflammation decreases, insulin sensitivity improves. Your cells become more responsive. Glucose is absorbed more efficiently, and this leads to measurable changes. Lower fasting blood sugar, reduced post-meal spikes, and over time, a meaningful reduction in A1C levels. But beyond the numbers, there is something more important. Your system becomes more stable. Your cells are no longer under constant stress. Your nerves are no longer being attacked. And instead of reacting to damage, your body begins to regain control. So when we talk about managing blood sugar, it's not just about lowering glucose. It's about stopping the damage that glucose causes. Because once glycation is reduced, everything else becomes easier. And that's where real progress begins. So what happens when the damage begins to slow down? What happens when your body finally has the support it needs? This is where nerve recovery begins. Because your nervous system is not just fragile, it's also highly adaptive. When the environment improves, when inflammation decreases, when nutrients reach the cells again, your nerves don't just stop deteriorating. They begin to repair. At first, the changes can feel subtle. You may notice slightly less burning, reduced tingling, fewer sudden sharp pains. But something else may happen too. Your sensitivity begins to return. And this can feel confusing because areas that were previously numb may suddenly feel more active, more responsive, sometimes even slightly uncomfortable. This is not a setback. It's a sign that nerve signaling is being restored because what you're experiencing is the system turning back on. The wires that were once weak or silent are beginning to transmit signals again. And as communication improves, so does function. Your coordination becomes more stable. Your balance improves. Your movements feel more controlled. Tasks that once felt difficult, like walking, standing, or even gripping objects, begin to feel easier. At the cellular level, energy production is increasing. Your nerve cells are receiving the fuel they need, and the protective layers around those nerves, often referred to as the myelin sheath, can begin to stabilize and repair. This leads to clearer, stronger signal transmission, less distortion, less noise, more accuracy. And as this process continues, the symptoms that once dominated your daily life start to fade. Not instantly, not all at once, but gradually and in a way that feels more natural, because this isn't about forcing the body to perform. It's about restoring the conditions that allow it to function. And that's the difference. You're not just suppressing pain, you're rebuilding communication. You're restoring connection. And when your nerves can communicate properly again, your body begins to feel like your own, stable, responsive, alive. And that's when real recovery begins. Now let's talk about one of the most underestimated nutrients in metabolic health, vitamin D3. Most people think of vitamin D as something related to bones or sunlight, but in reality, vitamin D3 acts more like a hormone than a simple vitamin. It influences multiple systems throughout your body, especially those involved in blood sugar control. One of its most important roles is supporting your pancreas, the organ responsible for producing insulin. When vitamin D3 levels are sufficient, your pancreatic cells become more efficient. They produce insulin more effectively, more consistently. But when levels are low, this process becomes impaired. Insulin production drops, and blood sugar becomes harder to control. At the same time, vitamin D3 plays a key role in reducing insulin resistance. Because producing insulin is only part of the equation, your cells also need to respond to it. And when resistance is high, your cells ignore insulin signals. Glucose remains in your bloodstream. Instead of entering your cells where it belongs, vitamin D3 helps improve this response. It makes your cells more sensitive, more receptive, more efficient, which allows glucose to be absorbed more smoothly. This leads to lower fasting blood sugar, reduced spikes after meals, more stable energy levels. But the effects don't stop there. Vitamin D3 also reduces inflammation, one of the key drivers of insulin resistance. When inflammation decreases, your entire metabolic system becomes more balanced. And because vitamin D3 receptors exist in almost every tissue in your body, its influence is widespread. It supports cardiovascular health, immune function, nerve protection, muscle strength, which is especially important as you age, because all of these systems are interconnected. So when vitamin D3 levels improve, you're not just affecting one pathway. You're supporting the entire system, and that's what makes it so powerful. Not as a quick fix, but as a foundational regulator, helping your body do what it was designed to do, more efficiently, more consistently, and with greater stability. So when you step back and look at the bigger picture, everything begins to connect. This is not just about blood sugar, and it's not just about symptoms. It's about a system that depends on the right nutrients to function properly. Vitamin K2 helps guide calcium, protect your blood vessels, and support insulin function. Benfotiamine works at the cellular level, protecting your nerves, improving energy production, and blocking the damage caused by excess glucose. And vitamin D3 acts like a master regulator, supporting insulin production, reducing resistance, and stabilizing your entire metabolic system. These are not random supplements. They are key components in a network your body relies on every single day. And when that network is supported, things begin to shift, not overnight, but steadily. Your energy improves, your blood sugar becomes more stable, your symptoms begin to ease. Because you're no longer just reacting to problems, you're supporting the system that controls them. So instead of asking, what medication do I need next? Ask a different question. What is my body missing? Because sometimes the solution isn't more intervention, it's better support. If this helped you see things differently, take a moment to share your experience. Have you noticed numbness, fatigue, or unstable blood sugar? Leave a comment below. And if you found this valuable, share it with someone who might need it too. Because the right information, at the right time, can change everything.